to climb, with over 70,000 people booked for their first dose at an ACT government clinic. I can report now that more than 95% of ACT residents aged 60 years and over have now received at least one dose of the vaccine. This is another national first for the ACT. If you've received a first dose, you are highly likely to come back for your second dose. So this gives us great confidence that our vaccine program will well exceed the national targets. At the younger end of the community, more than 50% of Canberrans aged between 25 and 29 and 30% of 16 to 19-year-olds have now received their first dose of the vaccine. So there is every indication that younger Canberrans will follow the same path as their older cohorts in getting vaccinated, and we have no doubts about vaccine hesitancy in the ACT. We are seeing such strong levels of bookings. What's been holding the Territory back has been lack of vaccine supply. But now that those supply issues are being overcome, it is incredibly encouraging to see how many people are coming forward to get vaccinated, to make their bookings and to bring their bookings forward when the opportunity arises. We still have a way to go though, but Canberrans are showing great willingness to get vaccinated. And this is so critical because a highly vaccinated Canberra is a safer Canberra. And our nation-leading vaccination program should give everyone great confidence that there will be much better times ahead later this year. So in conclusion, to recap for those who've joined late, 15 new cases overnight. In great news, 14 of them able to be linked, 9 in quarantine for their entire infectious period, 6 infectious in the community for part of their infectious period, 16 people hospitalised and 3 in intensive care. Dr Coleman will now provide an update on the new cases and epidemiology, and then we'll both be available for questions. Thank you.
Good morning, everyone, and thank you very much, Chief Minister. So, as has been provided this morning already, since our update yesterday, we have recorded 15 new COVID-19 cases, bringing our total for this outbreak to 478. We have 250 active cases at this point in time, with 228 having recovered from this outbreak. So just a reminder of the new cases today, out of the 15, 14 are linked to known cases or ongoing clusters, while 1 remains under early investigation. And out of those 15, we know that 11 are household contacts. 9 were in quarantine during their whole infectious period and therefore pose no risk to the community. All 6 of the remaining 15 spent some time in the community for at least part of their infectious period. Of our 16 people currently in hospital, 3 are in ICU, with 1 requiring ventilation. 13 are unvaccinated, 2 have received 1 dose or are partially vaccinated, and we're still tracking down the status of 1 person. Of our 16 in hospital, our youngest patient is under 12 years of age and the oldest is 75 years. There is very little change to the age range breakdown of our cases today. We have just over 840 self-identified close contacts and over 350 active exposure locations. But as I remind you, I think most days, please keep up to date with these exposure locations on our website. We also have no additional active public sites of transmission to add today, and there are no additional cases linked to our 7 active sites in the last 24 hours. So after that quick update, my shout out today is to our case investigation team. These are the people on the phones that reach out day and night to talk to our confirmed cases. They undergo several interviews with each case and they try and identify the movements and potential exposure locations of our cases as they come through. This information, this information that our team gathers is vital for managing the COVID outbreak. It really helps us to keep you informed of potential exposure sites, which is an absolutely essential part of our outbreak. The interviews take a really long time, and we thank all of our cases for investing in that with our interviewers, and they play a really big part in helping our epidemiologists form the links between cases and clusters that we need to understand how our outbreak is progressing. So if you do happen to get a call from one of our case investigators, please provide all the information that you have to help us identify how other people may have been impacted and really help us to stop the spread of the virus in the community. Thank you. I'll hand back to the Chief now.
Thank you, Dr. Hopp. Dr. Coleman, we're happy to take questions.
Chief Minister, with all those new vaccines and the appointments being brought forward, is there now an expected, the expected date where we hit those 70 and 80% thresholds, the 80% being in mid-November originally, is that now being brought forward as well?
I think the expectations are that the extra supply brings that forward by a couple of weeks.
Yes. So this is the first blue sky weekend since Canberrans were allowed to congregate for picnics.
It was very wet last week.
Are you concerned about an increase of cases, and are you going to be ramping up compliance measures?
Look, no, not at this point in terms of concern. I think the community pretty well understand the risk points, and because activity will largely be outdoors, almost exclusively outdoors in fact, and it might even lead to people spending less time in supermarkets and other places because they can be outdoors enjoying the sunshine. So I don't think there's a significant increase in risk associated with outdoor activity, and particularly if people are careful about keeping a physical distance from others. In terms of compliance activities, yeah, I mean, there's a focus for ACT policing on mask wearing. There's business and WorkSafe ACT compliance activities that are focused on construction, and Access Canberra teams are focusing particularly on retail, click and collect activities and hospitality, where mask wearing has proved to be more of a challenge.
Minister, the Canberra Liberals are calling for a more definitive, I guess, answer for parents on the return to school for children. You said yesterday that we'd get more answers on Tuesday. Will those answers just be for college kids, so year 11 and 12, or will it be definitive timelines for all age groups?
Well, you're inviting me to bring forward Tuesday's announcement to Saturday, so I won't be doing that, but we will provide further information on Tuesday.
For all year levels?
For all year levels, yes.
And just on that, should parents and teachers be laying the groundwork or preparing now for remote learning in Term 4?
Again, I don't want to make Tuesday's announcement today, so whilst I appreciate the intent of the questions and the desire to have early information, that sort of undermines the whole point of making an announcement on Tuesday.
Chief Minister, Reuters is reporting that the Pfizer shot could be made available for kids between the ages of 5 to 11 in October in the United States. Is this something you've heard about through National Cabinet, and will this be on the National Cabinet agenda at the end of the week?
No to the first question. We've only had very brief discussions at National Cabinet about vaccinations for 0 to 11-year-olds. That obviously, we were advised that there are clinical trials underway and activity occurring, but we haven't had a full presentation from health officials on that matter. I'm yet to see the agenda for National Cabinet for next Friday. Given that there's been a fortnight between meetings, I would hope that we will have the agenda and the actual papers associated with the agenda a little bit earlier than we normally do. Which can sometimes be as late as 10 or 11 o'clock the night before the meeting, or sometimes as we're walking into the meeting. The advantage of having a fortnight between meetings ought to be that papers can be circulated earlier.
And what would you be bringing coming up specifically or would like to see on the agenda for the ACT?
I will let me come back to that one next week. We've got a few things to focus on ahead of Tuesday's announcement locally. But one of the things that we would anticipate having further information on is the updated Doherty Institute modelling.
You mentioned Tuesday is basically when the roadmap forward will be released, considering restrictions. Now that we have all of these extra vaccinations and the threshold dates, will be brought forward a few weeks, is this going to impact Tuesday's announcement? Does there have to be a reworking of that roadmap? No, this information that I've presented this morning has, obviously some of it been publicly known, and then we were then able to ascertain what level of take-up there would be in terms of bringing forward appointments through our mass vaccination clinics. It was very encouraging. There's very strong interest, and that's pleasing to see. But we will be looking at our plan in the context of particular thresholds in terms of vaccination levels. 12 of the population 12 years and older, and based, as I mentioned yesterday, on the need for the vaccines to be effective. That is 2 weeks after you pass a headline figure. That's a very important point to raise, and that I hope is now very clear in the minds of Canberrans, that you don't get immediate protection from either your first dose or full protection from your second dose until about 2 weeks after you've had the jab. Your body needs time to develop its immune response to the vaccine. That takes a couple of weeks. Hence, people should focus not on the day that we might pass a particular milestone, but 2 weeks after that as being when the vaccine is effective.
Minister, just a few questions about the YAS LGA that came out of lockdown this morning. We've heard this morning that there were sewage fragments of coronavirus found in the sewage system. Were you made aware of that? And in your opinion, has the New South Wales government moved too quickly to open up that area?
I wasn't aware of a sewage detection, so that wouldn't alert me immediately, as it's not within the areas of responsibility of the ACT government. Well, as I understand what the Deputy Premier indicated, that might signal a change in position for that area, which would be obviously regrettable for residents of the Yass local government area if they only have 1 day out of lockdown.
Just on that as well, we've talked to a number of businesses just over the border, like horse riding schools and other businesses the majority of their clientele comes from Canberra, but because they're no longer locked down, they're no longer going to be eligible for that government's financial support. I know it's not technically the ACT, but will you be advocating for those businesses just across the border? So
they're New South Wales businesses, and it's their support, isn't it, linked to them being a COVID disaster area, or identified as a disaster area by the Commonwealth?
Yes, but because they're coming out of that, because they're no longer in lockdown,
right.
They might not.
I think that's probably a question for John Barilaro more than it is for me, because that would relate to New South Wales government economic support linked to the Commonwealth. It's not an ACT matter.
As regional New South Wales is opening up, how much sustained pressure are we expecting on our hospital system in ICU, and are we prepared for it?
We are expecting that some of the most severely ill people, particularly in the Southern Area Health Service, may need to come into Canberra Hospital. The numbers would be very much linked to the number of cases within that area, although we are given assurances by the New South Wales government that they have planned for this, and that they are making their decisions on easing their restrictions based upon the capacity of their health system. But we are cognisant that it is often the case that patients have to come into Canberra because Canberra Hospital is the only tertiary hospital in southern New South Wales. Questions for Dr. Coleman? Lovely, thank you.
G'day. Just wondering, our R rate, is that still below 1? And if it's above 1, how worrying is that?
So we received an updated report at the end of last week, and I haven't had a chance to go through that properly. So I think we'll discuss that a bit more holistically on Tuesday when we talk to what our plan is moving forward. So if you can bear with me, we'll get to that on Tuesday.
And just one more from me. The number of recovered cases will soon surpass the number of active cases if there is not a significant increase in active cases over the next few days. Will that have any sway on the decisions that are announced on Tuesday? How does that play into your decision making?
There's actually a discrete time frame, which is pretty set about how long it takes a case to move from an active to a recovered case. So I think this just talks to the progress of the outbreak. What I'm particularly interested in terms of decisions around next week and also moving forward is the amount of time and the number of people who are infectious in the community and how long that continues for, and therefore how long the risk of transmission is.
Can we confirm that one of the new cases is at the AMC prison?
So it's not part of the numbers that we're reporting on today because we do have a cut-off of 2,000 last night, as people know. But I can confirm that we did receive a notification this morning of a case associated with the AMC.
Do we know if it's an inmate or a staff member?
My understanding was that it was a detainee on transfer into the facility.
What are the protocols now for the prison, considering it's a vulnerable community?
So we know that it's a vulnerable community and a high-risk setting. So as per all our high-risk and vulnerable settings, we have some really good operational plans in place. So this morning, that is exactly what we're working through. We're working with all the people involved, we're collecting all of the information, and we will go through doing what we need to do. So just bear with us as we work through that process, as I say to you every time for a new case, and tomorrow we'll be able to provide you with a bit more detail on what the outcomes of that have been.
Up until today then, has there been in-reach programs for vaccination for the prison? Like, what are their rates like? Are they on average with the rest of the population, below, above?
So as for many of our higher risk community and cohort groups, we have been providing vaccination where we can, and there has been an in-reach program at the Alexander McConaughey Centre. It's very challenging to give you a vaccination rate because of the high turnover with detainees in there, but it has been available for many, many weeks now. As per a similar program, the correctional officers have also had and been eligible for vaccination.
I appreciate you might be able to give more detail tomorrow, but do we know how many people this person has been in contact with during transit, how many staff have had to go into isolation, those kind of numbers?
The notification only came through early this morning, so there is still work undergoing. I guess what I can confirm with people, though, is that as per routine practice, we're communicating directly with those people involved. So if you're concerned, you will hear from us if you are involved.
You mentioned yesterday, I think about 4% are considered breakthrough cases in the ACT, the ones that have been double vaccinated. Of those people, do you know if they were within 2 weeks of that their vaccination, where Mr. Barr keeps saying that we have to wait for that efficacy, or are we seeing it in some cases that the virus will, people that are fully vaccinated and it will still break through and they can then transmit that onwards?
So I can't answer that question for you today, Don. We actually haven't looked in detail at those cases. What we do know with breakthrough infection is that there are a small number of people who are fully vaccinated who still can get infected, get disease, and therefore can transmit on. But I can't let you know specifically of the cases in the ACT at this point in time.
We heard overnight that there is an exposure site at ABS House. Just wondering, I know a lot of public servants are working from home at the moment. Should those workers who were at ABS House, should they be working from home? I guess what are your concerns around that, and if they should be there at all?
So sorry, which house is that? I'm not familiar with that.
Census?
It may well be. I'm not familiar with all of the current sites, sorry. I guess our current advice is that working from home if at all possible, but if a need to come into the workplace, such as I have staff here working, and that's up to the workplace to decide.
Those household contacts that you mentioned, there's no increase to the clusters of transmission. Where have those original cases got them from then? Are they part of those unlinked cases that their household contacts have now expanded if they're not linked to any clusters?
So the new cases announced today, 11 of them are household contacts. Is that what I'm not sure where their primary is from, Dom. I guess this is just part of our ongoing update every day. I can't give you the chains that every day is reporting on.
Are we still looking at about 5 incursions into the ACT?
Yeah, I don't think there's been much change in that since last time we talked, but I think when I give a discussion on Tuesday about our pathway forward, we'll give a really comprehensive understanding of where we're up to in the outbreak, what we think the risks are moving forward to help people understand the decisions that we're making. So we'll talk to that as well.
Okay, we good? Okay, thanks.
Thank you.